Face.
Face plant, right?
Face plant. Beautiful.
So just know it takes everyone a while to get elevators. Come on in. Don't be shy.
Do you know offhand which room Michael's spirit are? I'm wondering if I can run him down just to see if I can see her.
He's down on the street.
Okay, like right below.
Right below.
Okay.
So you have to get in there. I mean, you can use the stair. Yeah, yeah.
Are you okay if I try it? I'll be back in like 5 minutes.
No worries.
Marina, do you know Marina Cavalti?
Oh, yeah.
She was my advisor. The only reason I survived school. Yeah.
Because there's no possibility.
When we were working on my dissertation, she was chair. I would get dissertation emails at 4:30. Just imagine her waking up with the rest of her family, like catching up on all of her work, getting her kids out of bed, getting them to school. No. Yeah.
So we always
Maybe she's maybe she doesn't have to sleep. She's just like reincarnated into everyone yeah. And when she does, when she's in here too, it's kind of like, here's where we are. We need you right now. And it's time.
minutes, just elevator.
The other room downstairs.
And then people get to the building,
There's less ozone, I guess. I will not be flying on this. So Jane, I shot my last chicken. That's awesome. This long, and she put a little plastic piece of cheese, like some sort of something she put in the chicken, and she plays a little chicken. Yeah, it brings a lot of people in this thing. It's gone. I don't know why. This is so weird that I feel better. I wonder what the bowels resonate right to their resonate. It's so in cardiac, I've learned that
We're gonna give it 2 more minutes just because. Thank you. Hey!
So you know when.
everybody. Hello, everyone. We're gonna get started. Welcome, and I'm gonna introduce Ramon, who's gonna introduce me.
All right. Good morning, everyone. Welcome to the second annual Columbia Commons campus-wide day of interprofessional action. My name is Ramon Rodriguez. I'm a third-year medical student at Columbia VPNS. This morning, I'd like to introduce our special keynote speaker, Dr. Jane Bogart, or as we affectionately call Jane. She's currently the director of the Center for Student Wellness at CUIMC. She joined CUIMC Student Health Services in 2008 after serving previously as coordinator of student health outreach and promotion at the University of California, Santa Cruz, and prior to that, director of health promotion at NYU for a decade. She taught at Teachers College, where she earned both a master's degree and doctorate in health education. Beyond this, she served as a trainer for the United Nations Population Fund, served as a past chair of the health promotion section of the American College Health Association, and is an appointed member of the City of Santa Cruz Commission for the Prevention of Violence Against Women. Even before entering the field of college health, Jane worked as a health education specialist at the Washington Heights Inwood Healthy Heart Program. She was also a certified fitness trainer and danced professionally on the show Fame. Jane has had an extensive career spanning decades promoting health and wellness, and I'm honored to be up here today introducing and celebrating her. A few weeks ago, I had a conversation with a friend of mine talking about what drew us to Columbia and what makes it so special. We both arrived at the same conclusion: the strength of the Columbia community and the level of support we have available to us is pretty remarkable. And by support, I mean the high level of compassion and investment coming from faculty members, even if it may not feel that way sometimes when we're being challenged by our respective programs. At the center of this institutional movement towards compassion, in my eyes, is Jane. Jane has played a very special role during my time at VPNS. Before coming to medical school, I didn't really know what it meant to engage in self-care and self-kindness. Until I took a narrative medicine course called Making Meaning, led by Jane, Dylan Marshall, and Dr. Laura Wasson, I never truly appreciated how embracing gratitude and vulnerability with intention can help me navigate and understand the visceral and unshakable emotions stirred from working in the healthcare environment. Jane has seen me through many difficult days throughout the past 3 years, embracing my burdens with compassion and teaching me lessons of self-kindness. Lessons that I try to live by and inspire in others. Jane has helped me feel heard and at home at VPNS. Beyond her illustrious career, she has brightened so many lives, and I feel grateful to be in the company of those she has imprinted with her joy, compassion, and love. Please join me in welcoming our keynote speaker, Dr. Jane Bogart.
I'm learning how hard it is to hear someone say nice things about you. Thank you, Ramon. And I am going to introduce my co-keynote speaker, Dr. Tim Cunningham. Tim and I met literally an hour ago.
Late, and you were late.
And we were both late. So when I was asked to do this keynote, I started doing some research on compassion and care in health sciences, and I Googled, which is basically how I start doing my research, and Tim came up. And it turns out that he had been here and done his doctorate at Mailman School of Public Health, and I work with Marina Catalasi, and many of you may know her. She's we were both saying our Shiro, and is in charge of what's called the Compassionate Care Initiative at the University of Virginia School of Nursing. And so I cold called him, and he picked up, which never happens. I didn't email. I just was I'm just getting on the phone, and I was you don't know me. how would you like to come to New York and speak? We have no money to pay you. We have no money for travel. We have nowhere to put you up. However, it's going to be great. And he generously accepted all of those terms. And we have been back and forth on the phone and by email, talking about these issues and things that we are both so passionate about. And so I'm going to introduce Tim. I'm so delighted. I am so grateful for your generosity of spirit and just showing up to do something that is so important and to talk about something that's so important for our students. So it's Tim Cunningham. Okay, you can use the mic.
Yeah, thank you, Jane. Yeah, we literally just met. And the only reason I picked up the phone was I was in my office, and I feel required when I'm working in my office to answer the phone if someone calls. And it was a New York number, so I got excited. Jane and I discussed this morning about how we are used to doing keynotes, but it's very rare that we do a co-keynote. So I think as we go through this process today, it's going to be really exciting to see how we bounce ideas back and forth, and you all bounce ideas between each other back and forth on what I think is an extremely important topic. A little extra background just to give some context. I was a professional clown for about a decade. I was executive director of an organization called Clowns Without Borders. The door is open back there if you're afraid of clowns. Like, I will not take it personally. I know that clowns do freak people out. And it was working as an artist in refugee camps and war zones that I became interested in healthcare. Went back to school, became a nurse. I'm an emergency pediatric nurse. I worked full time when I was doing my doctorate here at NYP Cornell. And I'm extra grateful for people like Marina, because while I was doing my doctorate, the 2013 to 2016 Ebola crisis started, and they needed nurses and docs and care providers that could hydrate patients, period. So I decided to go. I stopped my dissertation work and went to Sierra Leone. I got a letter from the provost here at Columbia saying, if you choose to do this, you are no longer a student, because we can't cover this. At the same time, there are a whole lot of speakers talking about Ebola here. Maybe some of you were here then. So I was not a student, but my advisors like Marina were like, F that, you should do your dissertation on Ebola while you're there. So I was able to do my dissertation. And it's so funny because then when I came back, Columbia and many other schools were like, oh, now you should speak about your experience. We're so proud of you. Isn't that curious? Nonetheless, I'm beyond grateful to have had those experiences, to train here, and then to be back to share some ideas. Should we start with an exercise? To begin, I'd like to introduce you all to a Jedi Knight exercise. I trust you, you're intelligent folks, you're receiving good training. I think you can handle this. I don't teach this to everyone because some people, if they learn Jedi Knight skills, their brains literally explode. But I think we can handle this. If you feel your brain start to tingle too much, just like slow down a little bit, take a deep breath, you'll be fine. I'm gonna ask everyone if you're able to stand. And if you're not able, that's okay too. We can do this sitting, but great. So we work in healthcare. We are pharmacists, OTs, PTs, nurses, physicians in training, chaplains, technicians. Who have I missed? Dentist, sorry. Oh, my dad's a dentist too. He would be so pissed. Excuse me, can I say? He'd be so angry at me. Dentists, yeah. Shout out to my dad. We work in a health system that I think all too often says we're not good enough. We're not smart enough. We haven't responded to enough emails. We're gonna fail at something, and when we do, everything's gonna crumble. And we hear that all the time. As a nurse, I continue to hear it. And I'm gonna show you this Jedi Knight trick to show that you actually are good enough, strong enough, smart enough, ready to take on this world. All right? So everyone, I'm gonna ask you to partner with the person next to you. One person's gonna be partner A, one person's gonna be partner B. If you've never met this person before, introduce yourself. Great. Anybody not have a partner? I think there's a person right here. Do you need a partner? There's a person right here if you all don't mind partnering. All right. Anybody else not have a partner? Jane, do you have a partner?
I do.
Okay, good. You get to be my partner. Okay, so partner A. Everyone pick a partner A. Raise your hand if you're partner A. You're either going to be partner A or partner B. Brilliant. All right, Jane is partner A. So what I'm going to ask partner A to do is extend your arm straight out like that, just like Jane's doing. And partner B, I'm going to ask you first to get consent from partner A. Is it okay if I touch your arm? If partner A says okay, radical consent, people, radical consent. Partner B, what I'm going to ask you to do is put your hands on partner A's arm above and below the elbow. We don't put pressure on joints, right? That doesn't do so good. And I'm simply, partner B, I want you to push partner A's arm down towards the floor, okay? So give it a try. And just... Jane, you are a dancer on Fame. You're a professional dancer. I know you can be stronger. For real, partner A, don't let them push your arm down. Partner A, give them force, okay? Awesome. Yeah. And then now, after you do that, make sure you switch up. So partner B, I want you to do the same thing. Jane, I'll let you, all right. Okay, did everybody have a chance to do that? I'm going to stand on a chair just for a second. So everybody have a chance to do that? Okay, now, this is the Jedi point. This takes a lot of focus. People are looking at me incredulously. For real, this is Jedi. What I'd like you to do this time, partner A, put your arm out. And this time, before partner B pushes it down, partner A, I'd like you to visualize a ball of energy that starts at your shoulder, moves all the way down your biceps, triceps, elbow, forearm, wrists, through your fingertips. And imagine that energy, maybe it's a light of a certain color or something, imagine that energy traversing like 100 feet from your fingertips and smashing against a wall or maybe flying across the Hudson River. Visualize that. Then when you're ready, nod to partner B, and partner B, try again to push their arm down and see what happens, okay? Take your time. And then make sure you switch it up, that each partner gets a chance to do it. All right, after you've done that, go ahead and take a seat. I know this is exhausting. Don't forget to hydrate after this practice. Okay, great. Anybody want to shout out what happened? You got stronger. Were you stronger the first time or the second time? Second time. Second time. Does everyone agree that you were stronger the second time when you shifted the focus a little bit? Did you feel like you're doing more physical effort the first time or the second time? First time. Interesting. So more physical effort the first time. I am not gonna fail. Yeah. Second time, I'm gonna breathe. I'm gonna visualize some positive energy. And I could do this all day long. We also work in a health system that demands time and hours and hours and hours of effort and work. So how do we as learners find the way to shift our focus? Because we actually already are strong enough, wise enough, and good enough. And I guarantee that when I say that, that's not a lot of lip service. I mean that from the bottom of my heart. I'd love to give a little brief background about the organization that I run, called the Compassionate Care Initiative at the University of Virginia. I'm going to share our model as we get into this discussion on compassion and social justice, and just a model that I would encourage you to maybe think about as we go through the conversation today. At the Compassionate Care Initiative, we work with nursing students, med students, students from the allied health sciences. We don't have a dentistry school at UVA, but we would work with dentists if we had one. And we believe in this simple frame that to provide compassionate care, it begins with self-care. You need a self-care practice. And with constant self-care practice, and there's evidence that says practice makes better, practice does not make perfect, but going to a one-day meditation retreat, you might feel real good for that day, but that also isn't going to make a lot of changes. It takes practice, consistent practice. We know that individuals with self-care practices are more likely to be resilient. We know that more resilient providers are more likely to provide compassionate care. And when I say compassionate care, I'm talking about care that's attentive, that authentically meets the needs of the people that we're working with and ourselves at the same time. Has anyone read any Audre Lorde? Audre Lorde's a feminist, activist, published these words in, I believe, the early 1980s, talking about this idea of self-care. When I say self-care, I'd like to propose this thought that caring for myself is not self-indulgence, says Audre. It's self-preservation, and that is an act of political warfare. So yeah, yoga's cool if you get into yoga. I mean, I can literally stretch this far, so yoga's not my thing, but that's okay. We know that yoga is a form of self-care. We know that meditation. We know that prayer. We know that engagement in community. We know that camaraderie, something that I learned doing the Ebola work, are all forms of self-care. But what if we thought about it as a way to actually preserve ourselves? Audre Lorde is a black woman, had to preserve herself so she could stand up against a country that was against her because of the color of her skin. As an activist, as a writer, as a feminist, she had to fight every day, and to do that, she needed to build her own way to preserve herself. And I would argue that everyone working in the health professions is also working against a system that is not really designed to support us, and maybe not really designed to actually support patients. So how do we care for ourselves so that we still can provide that level of compassionate care? And when I say compassionate care, this is what I think about. As director of the Compassionate Care Initiative, I often give talks, and I usually get, when I say, oh, compassion, people are like, oh, compassion. That's sweet. But what are you actually doing? And then I say, yeah, compassion certainly is holding the patient as they're breathing their last breath, nourishing the malnourished child, right? But I also think about compassion, for example, when I was working at New York Presbyterian Cornell and we had a patient come in, this big burly dude who had like a 36-pack. He was a professional bodybuilder. I mean, he was built, and he was on PCP plus a whole lot of other things, and we didn't know what. And when he rolled into our bay, EMS said, he seems uptunded now, but something's about to change. And we were like, what do you mean something's about to change? And the EMS provider said, this. The patient literally got up on the bed, started throwing things around the room. It took 12 of us to hold him down, 12 of us with maybe a gentle elbow in the throat, just to, keep him from moving. We gave him gobs of Valium, gobs of everything we could, to the point where we had to intubate him. That also is compassionate care. We protected the patient, we protected our teammates, we protected each other. Talk about interprofessional care. Like everybody in the friggin' ED was on this guy, preventing him from running rampant through the ED. We intubated him, and for about 24 hours when he came to and we extubated him, he was the sweetest guy I've ever met. And he said, I don't know what happened, but thank you for taking such good care of me. So when I talk about compassion, and I think when we talk about compassion today, something to think about is there's fierce compassion too. As we work towards goals of health, it's not always being nice, and that's okay. So those are a couple definitions that I love to put forward, and I think we'll share a few more on our topic today.
Thank you, Tim. So my experience, right, is working with students, being an advocate for students who are here on this campus. I've been here 11 years, and when I first got here, I started to listen to stories that students would tell me about their experiences training to be healthcare professionals. And there were things that I heard that really disturbed me about levels of hierarchy, about microaggressions in training, about people coming in with like such joy and excitement about training to do what they wanted to do and losing that somewhere along the way. And it really saddened me. And I became so much more aware, right, of the interaction of the person with the environment. So I have a doctorate in public health. I really like to look at, the entire climate environment within which people work. And you start to look at, as Tim and I will talk about, the healthcare system in a different way, in different ways. Like, where is the lack of compassion? Where is the lack of respect? And I think that this university and hospital has done a lot over the past 10 years to help with that. But I still hear the stories, right? I still hear people having burnout. There's tons and tons of research about the problem of burnout in medical students, in dental students, in nursing students, in all professions and hospitals. There's not a lot of research about what helps. So we're focusing a lot on the problem and not a lot on the solution. And we're proposing, right, that's compassion and equity are part of that. Part of the solution. Okay, why isn't it coming? Sorry. Okay, so we're going to talk today about burnout, and we're also going to talk about compassion fatigue, and a lot of times these things get conflated, so I wanted to really lay out what the difference is. So burnout is a syndrome, and it is related to job and work. Okay, burnout is related to being in an environment that does not allow person autonomy, that where the values of the person may not align with the values that they're seeing portrayed in the organization. And so when you are a burned out person, okay, when you're a person who's experiencing burnout, you feel exhaustion, you start to feel cynical. Some of you may notice some of these things in yourself. A sense of detachment from the work that you're doing, and a feeling of like being ineffective and not feeling accomplished. Okay, so this may be something that you're recognizing in yourself. The next is vicarious trauma. How many people have heard of secondary stress trauma, vicarious trauma? A few of you. That is an actual cognitive change that takes place within you due to the cumulative effect of seeing suffering or trauma in other people. And sometimes it's related to how it resonates with your own trauma that you may have been through in your life. And I use this example of how doing this work has shaped my view of the world as the very first time I ever came into the VEC. So, I work a lot with suicide prevention and students who are struggling and may have suicidal ideation. And so here we are in this beautiful building, we're taking a tour, and my first reaction is, someone could jump from here when we went out into the terraces. Wow, these staircases are very open and it makes me anxious. And so to me, that is how my view of the world has been shaped by the work that I do, because I think about those things. I go into a building and I don't appreciate the view first, I look at the danger, right? So that is vicarious trauma. And then we've got compassion fatigue. And I think we would argue that compassion fatigue is the big umbrella under which some of these things fall. And that is your just decreased ability to respond to the suffering of others. Okay? And Tim is going to talk a little bit about the difference between compassion and empathy, because we're really talking about compassion, but I think it's important to differentiate what those things are. Any questions? Feel free. Okay.
As we talk about, especially this idea of compassion fatigue, something that I personally struggle with is I ask if it actually truly exists. I did my dissertation on compassion fatigue. That's what helped me get silly letters behind my name. So there's something legit about it for sure. But as I've studied it more, I wonder, and I think about empathy and compassion. Is there a difference? I mean, this chart says they're a difference because they're color-coded differently. But when you think of the words empathy and compassion, does a difference come to mind in your experience? there's a fascinating group of studies from the Max Planck Institute by a researcher named Tanya Singer. Perhaps some of you have heard about her. She's a neuroscientist, and she's done work with fMRI where she's trying to look at the difference between compassion and empathy. And in her study, she found that people that have empathetic responses, so they get rolled into this fMRI and they watch a video of a painful experience. For example, someone getting their hand hit with a hammer. And then they measure that, right, yeah, it's painful. People are already making faces like, oh yeah, that's not pleasant. And they look at an fMRI and they found that people observing someone else suffering, similar regions of the brain light up as if your own hand was getting hit by a hammer. Right? Mirror neurons. Maybe some of you all have heard this term. We actually feel other people's pain. So as care providers, imagine feeling or responding to every person's pain that you experience when you go into a room to connect with them and treat them. And we think at some levels the brain is always doing that. Talk about compassion fatigue. Talk about burnout. Talk about vicarious trauma. If you're experiencing this over and over and over again, and not even registering just because you're used to it, right? What does that do to your body to degrade your empathy? So Tanya Singer was looking at that. She brought her subjects in. She's got gobs of research funding, so she can kind of do whatever she wants with as many subjects as she wants and have some really great results. She gave compassion training to participants in this study, loving kindness-based compassion training, and then put them back in the fMRI to witness more suffering. Folks consistently that received compassion training, the areas of their brain that would light up in watching the painful experience lit a little bit, but not as intensely. And then different areas of the frontal lobe, and I'm not a neuroscientist, so I'm not going to go into those details, but different areas of the frontal lobe that are associated with joy, that are associated with creativity, lit up amongst those who had compassion training. So when we talk about compassion, we think about the definition that the Dalai Lama gives on compassion. Compassion is witnessing suffering, then doing something about it. And Tanya Singer's research suggests that if we are acting compassionately and doing something about it, we're actually fueling a different part of our brain, which can build resilience, so we can get out of bed the next morning and work with suffering patients again, no matter what that suffering is. So as we think about the difference, empathy, this idea of putting yourself in someone's shoes, literally, and sometimes those shoes stink. Compassion might be sliding into those shoes for a hot second, then getting out so your foot can air out and see what needs to happen so you can change the situation. So as we think about compassion fatigue, maybe it's empathy fatigue that we're running low on. So I think really important to think about those two different terms, especially when we think about how that relates to wellness.
So I run a Center for Student Wellness. Like the name wellness is in our title. I am the director for student wellness. That is my job. And I struggle with the word wellness all the time because to me, it is not representative of what we're really talking about. It's one of those terms that because it means everything, it means nothing. So, for example, that's wellness. It is vitamins. Why am I so effing tired? Vitamins for high school genes. So this is Goop. And no offense to Gwyneth Paltrow. I read about her in People magazine all the time. But the idea that wellness is a lotion, is a scent, is a vitamin that you can take to feel better is to me not meaningful when we're talking about the level of burnout and compassion fatigue that we feel. Now, as Tim was saying, taking care of yourself, really important, right? Figuring out what self-care is for you, really important, and it may involve some vitamins. But when we talk about wellness and wellness programs, to me, it seems we're talking about something very much on the surface, and we're not digging deeply into what the needs of people are and how to change the system to actually make it so that we need less of that wellness.
Okay. Wait, you mean money can't buy me wellness?
No.
Oh, shoot.
It can help, though. So there's a word called well-being, right? There's a phrase of well-being, a little more measurable, and I think a little more granular as far as what we're talking about. That means taking care of yourself and being in a place where you can sustain who you are in all environments, right? When you're faced with the stressors of your life. And so when you think about this, we're talking about things like the space that you work in or live in. So I went to this great presentation in January, and they were talking about something called biophilic design. Has anyone ever? So biophilic design, thank you for those who raised your hand. Biophilic design is the idea that we need to have all of our senses stimulated in a work environment. And we're often working in places where the colors are the same, the textures are the same, there's no art on the wall. Sorry, Vec. There's no, there's a lack of, like I said, a lack of color, a lack of texture, a lack of scent, or sometimes it's a very antiseptic scent. There's that hospital smell that people really notice. And in order for us to feel well, we actually need all of our senses stimulated. They did an experiment in a university cafeteria where they played with decibel levels of music that they piped in. And at a certain decibel level, you are no longer able to focus. It's really challenging to focus. And at a certain decibel level, it's also really challenging to remember things. So if you're in an environment that's very noisy and it's not a really high decibel level, as you turn the decibel level down, people pay attention more. You notice different sounds. There is a too quiet decibel level beyond which it's a little jarring to the human being. Now, in New York, you will never reach that decibel level because it will never be quiet. I was in Mallorca, Spain, a couple of weeks ago, and I went to sleep. I was lying in bed and going to sleep, and there was no sound. And all I could hear was my heart pumping in my ears. And I was like, I have never heard that before. I can't remember the last time I actually heard that noise. So it was very disarming. So the idea of your environment, your physicality, right, promoting, taking care of yourself, psychological, so how the work environment helps you maintain your psychological health by allowing you breaks, by giving you autonomy, right, by connecting you to other people, by having community. We talk about this all the time, community and belonging on our campus, and yet we build buildings that are siloed, right? We don't have community space where we can all come together, which is why IPE Day is so amazing. And then just building that social environment, okay? So to me, this is a much richer, more relevant way of looking at it. It looks at the individual and the environment and the organization. And that's really where I think we need to go as far as thinking about wellness. Okay.
And we have to work towards it.
Yes. It is not going to just magically happen. So we chip away. And there are definitely things that we change. And, part of my role is to advocate and to work with students to figure out what they need and then figure out how to relay that to people who can make those changes. Okay.
And we know with the self-care and resilience literature that it's not a one-size-fits-all model. We did a survey among our nurses at the UVA health system. It was about 5,000 nurses. And we asked questions, what do you do for self-care? And those of you that are designing surveys and things like that, right? When you design a survey, you have all the prompts that you think people are going to respond to, and what do you put at the bottom? Other, right? So we had other there at the bottom. When we got our results back among our nurses, other ranked number 5 of 12 things. So I realized I failed at making that survey, one, but more importantly, what we realized was that when we say self-care, the nurses that we surveyed are doing it, but they just call it something very different. And instead of our health system saying, oh, not good enough, you need to meditate longer because we have more evidence about that, because more wealthy people put money behind that research, how do we flip that discussion to say, what are you doing and what do you need? And then how do folks like Jane and myself take that to the C-suite and say, these are programs that we need to build because this is what our individual students, colleagues, and staff are doing.
And I would add in, where are the voices that we don't have the power to be heard, and what are we missing, right? Who are we not listening to?
And we need to do that now with learners. Some of you have probably read the studies that look at med students and nursing students, both in their third year of training, have significantly lower empathy scores than when they came into medical and nursing practice. And other professions, I would assume it's probably similar in a lot of ways. I just haven't read the research on it. So what are we doing in education training that we're already pulling away this sense of altruism, and we see this literally erosion of empathy? How do we engage differently at the beginning so that we don't lose you all when you start your practice to burnout and problems like that? And there are some ways to do it. You have a narrative medicine program here, which is the best in the universe. Literally, in the universe as we know it. And one tool to address that is engagement with the arts and engagement with literature. It's abstract, it's out there, but it grounds us in a way that we can connect differently and think about things differently and hopefully see changes. And there are a couple of studies looking at changes in empathy scores among medical students and nursing students who had consistent arts engagement, and they scored better than their colleagues, matched samples of people that didn't have engagement in the arts. Million doors into the same room, but we got to find each and every one of them.
So one of the first questions I ask students who come to talk to us one-on-one, or someone who's coming to talk to me, is feeling sort of just like lost or burned out or whatever that person is calling it, is I ask, what are the things that make you feel like you? And how are those things something that you're not experiencing in med school or dental school or nursing school or public health? And where can we put that back for you? Because feeling like you is the most important thing in being able to take care of yourself, okay? And over the years, the things that I've heard and the things that I think we know from the culture of health sciences is this idea that, like, you know, if you're feeling stressed, you need to be stronger. And if you're not stronger, you probably can't handle it. And this sort of, sometimes I hear it as a generational divide where, like, oh, we're being very soft and we have to have safe spaces. I don't know if any of you have heard this as like a sort of in a cynical way, right? And so this idea of, no, we actually do need to take care of people. We do need to hear about their trauma and their experiences and where it's not working for them in order to fix a system that is consistently respectful and compassionate, right? And then there's tension that I also hear, and correct me if I'm wrong, but that there's a constant feeling of it being assessed, right? In an environment where there's a focus on score and grades as being primary driver for your like future job. And so we say that, like, sometimes that creates this really unhealthy environment for students to not trust one another necessarily, and to like lack some sort of compassion for one another. One of the things that I feel is really fascinating is how often students will talk about just a small kindness making such a big difference in their day. So we offer snacks in our office. Those of you who didn't know that. If you come to the Center for Student Wellness and the door is open, you're welcome to a free snack, one a day. We used to have unlimited, and then people would bring their backpacks and fill it up. So got a little bad for the budget. My boss is in the back. She would not want that. So we offer one snack per day. And I cannot tell you how many times a student will come in and say, this is the best part of my day. Like, this makes me so happy. And I'm like, if a mini bag of fruit snacks does that for you, A, I'm so glad we could do that. B, I think we need to put more happiness in that day, right? It's like that should not be the highlight of your day, even though I'm glad it is, and we can do that for you. And then we just talk about the structure, the hierarchical structure, which gets perpetuated even in the schools, the learning and the systems here of who has autonomy, who makes decisions, who has power, where are the structural injustices, where are the, if we're talking about clinical work, people looking at patients who remind them of themselves or their family members and see them being marginalized, and how that impacts you as a person and your sense of how to be compassionate and helpful, and where it prevents you, right, from feeling like you belong and feeling like you're part of a community. So yeah, so this is sort of my, oops, this is sort of, am I on now? Yes. So we do all these things. We offer exercise, we do yoga, you can meditate, you can do all kinds of things, and they're really important to do, and I wouldn't stop doing them. But I think that when that becomes the only program that's wellness, it's problematic because it's a distraction from really thinking about where's the toxicity and where do we need to change the curriculum and the culture. And that is where I want to focus. Like, that is the work that I think is so important to do on this campus, and the work that I want to partner with all of you to be able to do. Okay.
I think you're at the tide is changing when you look at research on resilience and burnout. Lottie Derby, Tate Shanafelt, and Colin West are sort of the dynamic trio of burnout researchers. If you've not read some of their work, you're likely to at some point in your training. Tate Shanafelt is now the Chief Resilience Officer for Stanford University, where his role is to build resilience programs. But their early research was it's all about you as an individual. You have to do this more. You have to fix this more. You and your full schedule need to add more time
Exactly.
to come by Jane's office and get a snack. Maybe you don't even have time for that, but you're blamed if you don't, right? And the literature supported that for years and years and years. And now Shanafelt, West, and Derby are taking another look and saying it needs to be owned by leadership as well, what we call a bidirectional approach. So as much as you are doing, we as leaders need to do as well, and you should demand it. Just to support what Jane is saying, you should demand it, you should push for it so that we can build that, so we can build towards a reduction of burnout.
Okay, so our next question, we had come up with some questions to ask one ourselves, but this is actually one we're going to ask you. What would it look like to apply an equitable approach to preventing burnout? What would it look like if you were part of that conversation and envisioning that? And so some of you may have you ever seen this? So this is a drawing that gets used a lot to explain the difference between equality, equity, and liberation. And the idea is, like, what does the fourth box look like? What's the next step? Because I would argue, and I was talking about this with Tim, when I look at this drawing, I still see people outside the field. To me, inclusion, right, would be actually those three people sitting in the stands. It always amazes me that that's not part of the drawing. That would be my drawing. And so we wanted to give you a chance to sort of talk to one another a little bit for like a couple of minutes, maybe pair with your Jedi partner, to say, like, what is the thing that you feel, like something that you feel is missing in your experience here that you would want to see shifted, that would make it feel like you were part of something, that there was inclusion. Okay? And then I would love at some point for you to email me those things so that we can start to work together on it. All right, so just take a few minutes, talk to the person next to you. I know, I'm loving it too. Yeah, you're so, I love watching you, it's great.
It's such a treat to be able to stand by
Yeah. And I felt like they needed to talk to one another again. I was like, okay, I'm seeing the energy go down. Yeah.
I wonder if we want to. Oh yeah, we should definitely.
Yeah,
totally. Yeah.
Okay.
Maybe I'll just mark this as just something to take with you.
Yeah.
It's nice to work with engaged students.
Yes.
I They want something fair to compare students.
It's very engaging. And I, like I want them to be engaged and I want to hear like what they have to say. And use that to frame how we do the work. Because I can look at all the research, but I want to know what the experience is.
And we can show impacts. I mean, I know we can show impacts by saying X amount of people into your own class.
Yes.
And our boss is going to be like, great, you're doing the work.
Yes.
And it's all lip service. And that can go on for as long as it wants.
Yes. And I definitely want people to do that. Like, I want them to come. I want them to, engage with the afternoon. I love it. But
it'd be cool if you could somehow measure the strength of resilience by someone that was prescribed something compared to someone who figured out it. I'm sure you would see
interesting.
much higher. If you think about ACEs,
Yes. Wow, that's an interesting proposition. Yeah.
Sure, yeah.
Yeah, I'll ask.
We could rather do that.
Yeah. Oh, I forgot those are the communications people. PowerPoint. Amy Cuddy.
We just did a conference last week where we emphasized therapists. So anyone, you could listen to the speakers, or you could get free body work. And like 60 people got free body work. So cool to have speakers.
We have a so we can students give them and then they go out to the students. We pay them. Hi. So I feel like we could spend the rest of the day doing this. Come on back. It's so nice to hear engagement, and as Tim and I were standing here, I kind of want to hear what people are saying, and so if anyone's willing to sort of share what they talked about or came up with, and because I'm going to write them down. Yes.
So in that last box, I would see a lot of heavy machinery to break down and remodel that whole entire scene, because as we've talked about here, giving those people out their glasses and helping them do gratitude practices to feel more inclusive is great, but it seems to be marginal percentage improvements without getting the core root problem, which we've touched upon but haven't really dove into that much, which is structurally there are some really deep problems with our medical system, both with the system training. God help all the future surgeons in here who have to go through sleep deprivation that is one of the more detrimental things to do to your health, let alone profit-driven medical system that has good things about it, but it's not designed for patients. And so that's something I think about. It concerns me a lot. Is there's a lot of, I'm glad you guys are helping us here, but it's a lot of really deep-seated issues in the culture, in the system, and all of it that need to be addressed. I think.
Yes.
Burnout.
Here. Anyone else had that same conversation?
Could everybody hear this gentleman?
No.
No, okay. So just to sum up very briefly, and I'll run the mic to the next person.
Okay.
Deep systems change. We need to look at deep, profound systems change and heavy machinery to dig that up if we really want to make a positive change.
Yep.
Thank you.
Okay.
I think I saw
Thanks,
your
Tim.
hand first.
So I guess I agree, deep systems change. And I think to sum it up for the nursing program, I think a university needs to stop biting off more than it can chew in terms of class size, how quick our program is. It's a 15-month program. And it seems obvious to all of us going through it that it isn't enough time to learn all of the skills you need to know. And then there's a push from the students to have classes that exercise empathy and learn about populations and cultures. So we don't go into these situations with patients of different cultures blind. And they try to, I think, meet that need by throwing in classes that don't match with the skills-based classes. And that smattering of like just throwing a cultural-based class in between 5 classes where you're going to get graded every Friday on the skills that you need to know perfectly step by step. It's impossible and it's illogical as a student to prioritize learning in that cultural class when you have all of those priorities thrust upon you in those skills-based classes. So Megan and I were talking about how it would make more sense if the program was longer, if there were maybe a smaller class size, because there's about 200 of us, and that's constantly, when we give feedback, that's the constant response as well. There's just so many of you, there's just no space, there's not enough teachers. It's like, well, you brought us here. You didn't need to bring 200 people. So yeah, it's like they need to be realistic about the time it takes to learn those skills, and then maybe a semester with those cultural classes all together, so they're not fighting to be prioritized with the other classes.
Okay, great, thank you. And maybe also making it not a separate class, but infusing it into everything you learn. Okay.
Thanks. So in our little trio, we were kind of curious how you get from box equity to liberation, like someone had to tear down that fence. And this kind of links back to the idea of the heavy machinery. I feel like it's really important that the 3 people that we're seeing there play a role in tearing down that fence or play a role in operating that heavy machinery. Because I feel like the times where I felt most empowered and had the most buy-in and felt the least burnt out was when I was involved in the process of creating system change.
Great. Over. I'm taking notes.
Hi, so I'm in the PT program, and me and my 2 classmates were talking about how, for us, I'm not really sure what it is for the rest of the programs here, but I know for med school you don't have to go to classes, and we do. And so that makes things very difficult for us, just because we're in class from like 8 to 5, and that, like, things as simple as like making a doctor's appointment is impossible. Like, we can't like go to the dentist, we can't do our checkups, we can't do these basic things that we need to do to take care of ourselves, and that makes it very difficult. And like, if you do miss class, it's like a huge deal. So it's just something, so we were thinking about maybe like having a discussion with the program and kind of like incorporating a day off to not only to catch up on like group work and things like that, but also just a day for us to be able to make our doctor's appointments, for us to handle the other things in life that we need to handle. So, yeah.
Great. Another? We'll take one more, and sadly, we need to end. But I want to continue the conversation.
Morning, my name's Frankie. I'm a first-year med student, and I'm also one of the curricular reps for our class. Mine is more of a question that sort of ties in what everyone was talking about. So, Jane, you and I were in a committee meeting like 2 months ago where we were talking about sort of burnout rates and wellness, and you had said that I think we're probably on the national average where you know other health science schools sort of fall in those numbers, but when people come to see you, we basically just send them right back into the system that's sort of exists as it does. And then Tim, you had mentioned that maybe the system isn't even designed to really handle all this stuff. So my question is, as we talk about sort of these massive systemic, changes that need to happen, I'm pretty confident that at sort of like the educational level, we can get there. I mean, that's why these conversations are happening. It'll eventually will probably take hold. But instead of waiting the 10 to 15 years for the people in this room to be actually on the other side of the table and driving that change down, what's happening at the healthcare system level or the hospital level, and what's the tether between here and there? So those things are not sort of shocking or just completely generational or something that we have to wait for this crowd to actually change.
Yeah. And I think it's a great question. There are, and I don't have time to go into some of the things that are happening, but when you talk about a healthcare, we have a broken healthcare system. right? I mean, most people would agree to that. And it's a profit-driven, insurance-driven healthcare system. Interestingly, when I was in Mallorca, I had to go to the emergency room because I fell and hurt my knee. And I didn't have to wait at all. And I didn't have to wait for anything, like x-rays, nothing. And when I left, it was $400, which I was like, I just imagine being at NYP. And I love, it's my place. I love it. But the hours that you might spend in the emergency department. And so I don't know the answer to that, but I do know that there are people who are willing to listen. And I think that has to be, in some ways, a starting point, and people who are looking to make policy and systemic changes. We just need to ally ourselves with them and find them. But I think there is a dedication to trying to make things better.
Absolutely. I've got just two brief points I'd love to make
Go
towards
for
it.
it.
Closing on my side. The first is also in response to that question. There's currently a position in an Emory healthcare system, and I know this because I might take that position. And it's a new position, and it's designed to have someone at the C-suite, at the board meetings, talking about these things, making sure that programs are being developed for everyone on the allied health team at the bedside, starting at the boardroom, because traditionally it's all been at the bedside. So there is a slow sea change happening. And a thought I'd love to leave with you all as that change happens. Yep, it's going to be better in 15 years. 100% sure it's going to be better in 15 years. In the meantime, and I'm looking, are these the dental people here? Sorry to put you on the spot. Sorry, not sorry. I almost lost my dad to suicide. He's a dentist, and when he was in training, burnout didn't exist. He was always told, suck it up. Produce more, do more, work more. It's your fault if it doesn't work. I'm grateful he's still with us. He's an awesome dentist. In fact, he just retired, and I'm never going to see another dentist because he's the only person that's ever worked on my teeth and will ever work on my teeth because he's that good. The sea change is slow, so in the meantime, I'd encourage you all to think about the heart. The heart, with every beat, feeds itself before it feeds the rest of the body, right? The heart pulls blood from the lungs, pumps blood into the lungs, pumps the newly oxygenated blood back from the lungs first to feed the myocardial tissue before it gets the blood to the rest of the body. So it is on you all to preserve yourselves as we work with you to try to make this sea change. And I think we have to look at it from both angles.
Yes. And I would add to that, you don't have to do that alone. That's why we're all here.
Yeah.
Okay. We're going to send you off into the day. We want you to keep thinking about how this all works. How do we fix systems? Which came first, the chicken or the egg? And I'm going to leave you with this quote from Jim Henson, which kind of represents my sort of view of the world. When I was young, my ambition was to be one of the people who made a difference in the world. My hope still is to leave the world a little bit better for my having been here. It's a wonderful life, and I love it. Go forth and be interprofessional together. Okay.
Thank you all.
Thanks, Bert.
Yeah.
I just wanted to thank you, and thank you especially for sharing about your dad, because I really appreciate that, and I really appreciate that somebody's saying it out loud. So, thank you. Yeah.
Hey, Taylor. Nice to meet you. Oh, right. Yeah, a long time ago. Yeah. That's. Oh, cool. Yeah. Now it was because it was on like the downtown campus, right? Yeah. Sweet. Yeah, that was a while ago. Were you undergrad then? Or? Okay. Cool. Right on. Wow. Yeah, it's like pulling teeth. It's so painful. But people. glad you're doing the training. Absolutely. It's great to see you too. Yeah, qualification too.
Yeah, okay. Do you have any advice?
Yeah. And are you thinking what
I was
I think I would get a few photos to both test a couple of questions.
we need to have them. Yeah.
Have a study and ask us to think about what questions so you sort of get that. Awesome. Try to test the questions out on other people that you know. So if you can get a large answer, then you will be just to see how they respond. And anything with qualitative is that because it's so subjective. You want the questions really to so if you can test them with others first, don't worry about that data collection. You're also going to hear the way people respond. So you might be ready for certain responses. When you hear them again, say, oh, that might be a more common response. If surprise responses come up and you hear them repeatedly, you will be less surprised than you are.
Yes, for sure. My second question was, you talked about the Tanya Singer's study.
Yeah.
What was the compassionate training comprised of, and what exactly was that?
Sure. So she looked at
The only thing you would get is
teacher.
yeah, there's a lot of things that are focused on
But her focus is learning behind responses. And so Tanya Singer worked with her and looked specifically at, are you familiar with loving kindness? It's also called meditation. So it's I don't know it yet. Loving kindness begins with the person focusing on someone they love. A child, a pet, a parent, someone that it's easy to love. And you think things like maybe happy, maybe safe. You sort of say words to them in your mind. You feel good about it. And then when you're feeling that, you move to someone that maybe you don't know, an acquaintance, maybe you're in an office, and you say the same thing with the same nature of be happy, be safe. And the next step, while you're still feeling that, you think of someone that you really don't like. Maybe you know them, maybe you don't know, but you try to give the same energy to them that you did to the person you love. And then when you end it, you say it to yourself.